I don't have that stupid Obamacare. I'm covered by the Affordable Care Act.
The Affordable Care Act is Obamacare, genius.
About healthcare today, and which plan do you support? Obamacare or the Affordable Care Act?
The Affordable Care Act.
And what is it about Obamacare that you do not like?
I just think that there's a lot of holes in it, and it needs to be revamped. I think
And you think
hasn't been thought out.
You think the Affordable Care Act is a better plan than Obamacare?
Better, but I'm not happy with that either.
What do you agree with? Obamacare or the Affordable Care Act?
I'm more sort towards the Affordable Care Act, but I'm also very sympathetic for people that don't have the ability to have proper medical insurance.
So the Affordable Health Care Act is still a better option than
Yes.
Obamacare?
Yes.
And why do you not agree with the Affordable Care Act?
Well, I think it's not really available for all.
So the Affordable Care Act is more affordable than Obamacare?
Just the name says it all.
Right. You would agree with the Affordable Care Act?
Absolutely. I think it's nice that everyone can afford it, and everyone should be able to afford it, but to force people to pay something and then doctors to make something, limiting their ability to do their job, that's kind of anti-American.
Right. So Obamacare is un-American?
I think it's kind of un-American to force people. What if they can't afford it? What if they want more coverage?
And the Affordable Care Act is American?
I think it's more American because it allows people to make their own choices on what they want and who they want to work with.
Do you agree with the Affordable Care Act or Obamacare?
The affordable.
And why do you prefer the Affordable Care Act over Obamacare?
I just don't agree with the whole Obamacare policy thing that's going on. I just don't agree with it.
And do you believe that an informed citizenry is essential to a democracy?
Yes.
So you disagree with Obamacare?
Yes, I do.
Do you think insurance companies should be able to exclude people with pre-existing conditions?
No.
Do you agree that young people should be able to stay on their parents' plans until they are 26?
They should be able to, yes.
Do you agree that companies with 50 or more employees should provide health care?
I do.
And so by that logic, you would be for the Affordable Care Act?
Yes.
What plan do you support, Obamacare or the Affordable Care Act?
The Affordable Care Act.
And why do you support that over Obamacare?
Do not like Obamacare. I don't like anything that has to be forced for everybody to buy. It's just not good.
Do you think Obamacare is socialist?
Yes, I do.
Do you think the Affordable Care Act is socialist?
No.
Do you believe that Obamacare will eventually lead to gun prohibition?
Yes.
Do you know that Obamacare and the Affordable Care Act are the same thing?
No, they're not. Thanks, you made me look stupid.
That's what we do.
Okay, you did good.
And yes, the level of ignorance in these MAGA people is just unbelievable. Yes, and also I had to say it's also a big level of racism here too, because they don't want anything to be with Obama, and because they say Obamacare. And this is the thing, you know, the Republicans made this terminology, the Obamacare, because it was called since the beginning the Affordable Care Act. And they just decided to put that nickname, Obamacare. And I'm glad that Obama say, I'm glad that you guys put me that I care, because I do care that people can be covered with pre-existing condition. I do care the kids can stay in their parents' insurance until the age 26. I do care that the kids can have insurance and everybody can have a fair treatment when you get sick. So I'm glad that Obama just took that point and run with it, but I cannot even believe it happened like almost 16 years since the Obamacare we start working with Obamacare in our insurance, and I cannot even believe that they still don't understand what is Obamacare and what is the Affordable Care Act, that both things are the same thing. This is unbelievable, but stay towards the end because this video is going to get really interesting.
You know, MAGA's so stupid, they don't even know that the Affordable Care Act and Obamacare is the same thing. It's this reporter going around asking MAGA would they rather have the Affordable Care Act or Obamacare, and they said the Affordable Care Act, and he asked them why. And some of them is being honest, it's because they don't like Obama, and some of them was saying that they feel that the Affordable Care Act is more affordable for people, not knowing that it's the same thing. That's how dumb they That's how dumb and hateful they is, and that's how I know they believe everything Trump say, because Trump has said something similar to what his followers saying. Like, it's the same thing, y'all. Affordable Care Act, Obamacare, same thing. Same thing.
I cannot believe in the year of our Lord 2025, in the United States of America, there are people who live in this country who do not know that Obamacare was a slur by the Republicans for the ACA. I can't believe it. You know, the world used to think that Americans were intelligent and smart. But because of this TikTok, the world now realizes that Americans are easily manipulated, lied to, and they just absorb it into their brain. The latest is that because of the ACA, premiums have gone up. No, that's another manipulation by the Republicans. Corporations, United Healthcare, Cigna, Humana, all of them set the rates. Corporations. And how do they set the rates? They have what are called actuaries. Actuaries. And it's a game of like chance. The actuary calculates how many of you Americans will seek health care, what the premium will be, and how much profit they will make. Yes, that's how it works. It has nothing to do with the legislation. It has to do with GREED. This is what Luigi was trying to tell you.
So I saw this tweet floating around and it had a lot of thoughts. Apparently a bunch of y'all on here are breaking down because y'all just realized that Obamacare is the Affordable Care Act. Continue to read the tweet. The heartbreaking part, so many have pre-existing conditions. One man admitted he voted for Trump without knowing it was Obamacare that allowed his mother with stage 4 cancer to get treatment. This is what happens when misinformation wins out over facts. But can I tap in about this whole situation? Because there's some other stuff that's going on here. It's not the fact that it's just misinformation. It's the fact that too many people were way too comfortable voting away other people's rights. But when it came time to learn about the things that they had done, the things that their hands had wrought, the things that their vote had rendered, they realized that a lot of their things are on the chopping block. And now they're in their feelings. Now they're getting emotional. Now they're getting scared. You see, when it was other folks, they didn't really have this concern. They didn't really have this care. Or worse, they were gleefully voting against other people's rights and other efforts to show care to other folks. They were excited about that. They were ready to take that down in a heartbeat. So now that they're realizing that their own problems won't be solved, in fact, they might be exacerbated way worse, now everybody's in their feelings. Pardon me if I feel no sympathy for these folks. These folks who are excited about taking opportunities, taking care, taking rights away from others. So excited, in fact, that they didn't even attempt to read, to discover, to learn what these different things meant as far as the tariff, as far as the Affordable Care Act, as far as many of the legislation that will keep them protected. Now there's a real possibility of all of that falling away. Now they're getting scared. I'm finding it very difficult to feel any sympathy for people who were gleeful, excited to take other people's care, opportunities, and rights away, and then woke up and realized theirs too were on the chopping block. You get what you pay for.
So according to The Hill, they believe that the government shutdown is going to end next week, that the Republicans and the Democrats are going to come together. And the Democrats feel like they won because they wanted to show the public how much your insurance cost is going to be. In fact, open enrollment happens this weekend for ACA. I actually start this weekend as well with my husband's private company, and we'll see how much insurance rates have gone up. The fact is that millions and millions of Americans are not going to be able to afford the insurance rates that they are proposing. That's great. You have food to eat. The food stamps are there in effect. But what happens to those people that are medically fragile and need medication, or new people that find out they have a diagnosis of cancer? Oh, God forbid you're in an accident and you need long-term care. What I want Republican MAGA lovers to see is that the Democrats were thinking about you when they were holding on. So if you have ACA or private health insurance, I really need you to look at your benefits starting this weekend, because it's not looking good for you. Are you going to be able to afford your medical insurance? Are the babies and the elderly going to get their health care needs met? The only people fighting for you are the Democrats. I hope you remember that when you start paying double or triple the amount of your insurance. It's definitely going to go up at least 18%. I don't even know what to say. Anyway, you guys have a blessed day.
They're finally getting rid of Obamacare. Did you know that? They're finally getting rid of Obamacare. Realize that Obamacare and the Affordable Care Act are the same thing, right? Some kind of leftist? That's bullshit. That's not the same thing. The Affordable Care Act was enacted in like 2010 when Obama was in office. But I didn't vote to get rid of the Affordable Care Act though.
Yes, we are still in the middle of the government shutdown. Just a judge just signed an emergency agreement for the $5 billion that is needed. It's not completely the whole amount of money that is needed for pay food stamp, because I believe the bill every month for pay food stamp, I believe is around $8 billion, but at least the judge released the contingency $5 billion to pay food stamps. So I am really happy for that, but we're still in the middle of government shutdown, and what the Democrats are fighting for is for people can have health care. Okay, that this is what we're fighting for. We're fighting for people all can have health care, and yes. And I don't know if we're going to be able to have it. I don't know if the Obamacare is gonna be able to extend by this fight. I don't know. We'll see. Okay, stay towards the end because it's gonna be interesting. So stay.
Let me make this crystal clear. The Affordable Care Act is Medicaid. Obamacare is Medicaid. It's not a straight Medicaid, but it's an extension of Medicaid. And they're coming to snatch it. I'm a global strategist, and I know the system well enough to walk away from it. The Secretary of Agriculture just gave you a warning wrapped in a soundbite. You got 2 moves. Download the American Escape Plan if you're ready to go. Book a crisis call if you stand but need a strategy. No BS, no maybes. Click the link in the bio. Here's what they don't want you to understand. Medicaid is a public health insurance program for low-income Americans funded by both federal and state governments. The Affordable Care Act, known as the ACA or Obamacare, expanded Medicaid so more people could qualify, especially adults without children or disabilities who were previously locked out. With that act, you get part of your insurance subsidized. You pay a lower premium while the state and federal pays a portion of it. For instance, my monthly is roughly $50 a month, where the rest of the subsidy comes from the state and federal money. And because I am self-employed. Small businesses can also get Obamacare or the Affordable Care Act, as we call it here, covered California, through a small business. In simple terms, Obamacare is just Medicaid expansion with a different name. That is why they hate it. Not because of how it works, because you got access. That single policy gave health care to over 21 million Americans who wouldn't have had it otherwise. You know what that means? That means you can go to the doctor without insurance through your job. That means millions of gig workers, black mothers, disabled folks like me, and elderly people finally got care. So now they're trying to strip it back, state by state, policy by policy. until you left with nothing but private insurance scams, unpaid medical bills, or forced labor just to stay insured. And the latest statement, the Secretary of Agriculture wants to push you, a Medicaid recipient, into the fields because they're planning on strategic deportations and want 100% American labor. This is not about reform. It's about replacement. And I'm going to say this. I don't care if you take this seriously, but I do know this. The people who bought the guide or booked the call, they'll be ready. They'll be prepared. The rest will be crying next month when they're locked out. This isn't a debate. It's a binary choice. Get the American Escape Plan and fix this now. The link is in the bio. Or book a crisis call only if you're ready to execute. No, maybe later. Later doesn't exist. The doors are closing. Click now or get left behind.
You know that Obamacare isn't even a thing, right?
Right. It's a moniker.
Right. So we just call it something. We had to come up with a name for it.
Right.
The world. It's really the Affordable Care Act. If you run up a $20 million medical bill, they're going to pay it. They have to.
Right.
It's the way that the rules are. This has stayed in place over time. Mm-hmm. But in that basics, we had all of these minimum essential benefits. Your preventative care had to be covered. All of your mental health had to be covered. Pregnancy had to be covered. So everyone got maternity coverage. And back before that, you had to pay extra for it. Did you even get it? Or could you even get the policy, right? So now everybody's got the ability to get coverage. And they created this affordability factor of the Affordable Care Act. Because if the government didn't subsidize the cost of this insurance, it wasn't affordable, right? If you didn't get any help, you didn't want the coverage, you couldn't afford the coverage.
Let's extend the ACA subsidies so we can open the government. No, you're not in charge around here. Those subsidies end at the end of the year. The CR in front of the Senate right now opens the government till November 21st so we can negotiate the subsidies during that time with an open government. Except the subsidies need to be dealt with now as open enrollment for Obamacare begins on November 1st. And insurance companies are already raising premiums in anticipation of the subsidies running out, which will raise premium payments by over 300% for some Americans, which will cause millions of Americans to lose their health care as they are priced out of the system. Okay, and Republicans have said the plan was always to discuss these and healthcare in general during this time, but with the government open. And Democrats are saying, we don't trust you. This is too important of an issue, and we need a deal now to save millions of Americans' healthcare. The issue is because of this shutdown, 41% of HHS employees are furloughed, including many healthcare and insurance experts. And for an issue as important as healthcare, Republicans want the full force of government debating and discussing the topic. Except it's pretty clear what needs to happen. The Inflation Reduction Act in 2022 extended COVID-era subsidies that made healthcare affordable for millions of Americans, but that extension ends December 31st. Those enhanced subsidies were created during an emergency, COVID. If they go away, all that happens is a reversion back to the original Obamacare subsidies. Obamacare was always meant to be expanded as it was never enough in its original form, and now we must deal with the facts on the ground, which says there will be devastating consequences if they're eliminated. Look, I think many Americans would agree Obamacare has been a failure. Premiums have risen over 60% since its passing, while insurance companies reap record profits from these subsidies. We need to actually consider transforming and bringing real changes to the ACA rather than continuing to feed this beast. Well, since the ACA, the amount of uninsured Americans has been cut in more than half, plus the rate of premium increases has slowed, and even Marjorie Taylor Greene admits her party has no plan on healthcare, and regardless, with the subsidies ending in 2 months, this is the urgent piece of action. We have plans from health savings accounts to reducing regulations to just having less government involvement. If you look at inflation since 2000, the cost of industries heavily subsidized by the government, from healthcare, education, and housing, are all up a ton, while the things with no government involvement are down. Let the free market reign. It works. That seems like a very cherry-picked chart, as the free market doesn't do a great job in things like ensuring poor Americans with pre-existing conditions can afford healthcare, which is where the ACA has made obvious strides. And the important thing now is to extend these subsidies so Americans don't wake up on New Year's Day 2026 in a healthcare crisis. Again, open the government so the negotiations on this can begin. They can begin right now. This just sets a horrible precedent. The minority party shutting down the government whenever it wants healthcare changes. Wait till the roles are reversed and you'll see. We'll let the American people decide if this issue is worth what's happening. We will see, indeed.
Obamacare was not a disaster, and I really wish y'all would stop spreading that lie. And it's got to be because either A, you're too young to remember what the financial market and environment looked like back in like 2006, 2008, or you got a very short memory. I entered the workforce back in 2006, the same year I entered college, and the minimum wage was $5.15 an hour. Maybe 1 or 2 years after that, it was $6.55 an hour. At $5.15 an hour, $6.55 an hour, you were not getting insurance through the company. I remember that vividly. That premium was going to at least eat up 1 week of your check, and you only making $200 a week anyway. And you for damn sure wasn't going to get it privately because the premiums are even higher. This is why people back in the day told y'all, get a job with the post office, get a job with the city, get a job with the state, work for the government. Why? Because you may not get rich working for the government, but them benefits are going to make sure you're taken care of. But if you want to know the value of the ACA, you can just look at the benefits they celebrate. Do you know how many people were denied coverage due to pre-existing conditions? Do you understand how many people had the prices of their insurance jacked up just because they got sick? Y'all are harder on this legislation than y'all are on the companies that cause need for legislation. High premiums existed long before the Affordable Care Act. High deductibles existed long before the Affordable Care Act. Medical debt definitely existed long before the Affordable Care Act. In fact, medical debt has always been one of the leading causes of bankruptcy in the United States. The Affordable Care Act was originally meant to be a step toward universal health care. The problem is nobody else has taken another step to actually accomplish the goal of universal health care for citizens of the United States. Y'all got to start doing some research on your own instead of regurgitating these talking points that are completely unfounded.
It was the main thing, okay? People that needed to have health care, they was working in like a McDonald's or they was working in any other place, for they can just cover their insurance. They needed to pay almost like they needed to work just a whole week to cover their insurance. And sometimes their insurance that they had, they didn't even cover all the things that they needed. The insurance that we used to have, they were crappy insurance. And thank you to the Affordable Care Act, we got the subsidies that we needed for we can just cover we can cover the insurance, for we can have good insurance. Okay, insurance that cover everything. Insurance can cover pre-existing conditions. Insurance that doesn't have no limit in how much they can cover. So Obama wanted Medicaid for everybody. That's what it was in the beginning. But Republicans didn't want that. They wanted the insurance to still operating. So Obamacare was the compromise. It was the compromise right in the middle.
Republicans have had 15 years to come up with something better than Obamacare. That should tell you everything you need to know.
So it's official. Congress waited too long to extend the enhanced ACA subsidies, and states say it's now too late to avoid chaos. Open enrollment starts November 1st, but insurers have already filed rates, assuming those pandemic-era subsidies will expire at the end of 2025. So that means people shopping for coverage will see massive premium increases, especially middle-income families who were protected by those expanded tax credits. So once those subsidies vanish, it's not just a few dollars. It could mean hundreds more per month for basic plans. And even if Congress tries to fix it later, states and insurers can't just flip a switch to reapply subsidies. Systems are locked, rates are approved, and the math is done. Any last-minute patch would cause billing errors, refunds, or people paying full price until corrections happen months later. So for millions who depend on these subsidies, this isn't a political problem, it's a survival problem. Missed medications, skipped checkups, and delayed care always follow when premiums spike. Nurses see it every single time affordability drops. This is the fallout of delay. Sticker shock is coming for ACA plans in 2026, and there is no clean fix left.
And yes, you guys, what do you guys think? What do you guys think of MAGA, how they are now crying? Oh, we're gonna lose our health care, and they don't even know. So they are like, I'm glad that I have the Affordable Care Act. And then that I don't have Obamacare because they're going to repeal Obamacare. And then the Obamacare is Affordable Care Act. Oh! Yes, so just keep doing that. So we just made it towards the end of this video. Please don't forget, drop a like, comment, and subscribe. It really helps my channel to grow and helps other people to find my content and my video. Thank you.
I had a conversation with my stepdad today who voted for Donald Trump, who cannot afford health insurance without the ACA tax credits. I said, hey, Pa, you know the whole reason the government is shut down right now is because Democrats want to extend these ACA tax credits. He said, wait, I thought it was about illegal immigrants. And I said, no. And I Googled right in front of him. I showed him that undocumented migrants, they can't qualify for Medicare or Medicaid. I explained to him that the ACA tax credits, which he's familiar with, he knows what they are because he knows it's what brings his premiums down. I said, those are set to expire. And I showed it all right in front of him. Now, my stepfather, he's not an ignorant guy. He's just not informed because he does watch Fox News, Newsmax, OAN. He looks at me, he said, why didn't they tell us? Like, why is the news media outlets not telling us? And I said, they don't want to tell you because it'll make them look bad. Now he's worried about his premiums doubling. And I said, Pa, let me show you something. I opened up Ground News right here and I said, see this? There are 133 news media outlets reporting on the fact that your health insurance premiums are going to double. Only 4% of that is right-wing news media outlets. And his jaw dropped. He looked like he'd been betrayed. And I said, dude, I'm going to get you a Ground News subscription right now. And I showed him this feature right here. It says blind spot. I said, Pa, look at this. If you toggle this on, blind spot for the right, you will be able to see every single story that OAN, Newsmax, and Fox News is not telling you. Thing is, people like my Pa and those who are voting against their own best interests aren't doing so because they don't like themselves. It's because the information is not getting in front of them because they have chosen to listen to one news media outlet. And that's why I like Ground News. It helps you, especially the older community, snope through the biases and get all the information in one place. If this is something that interests you, hit this link right here, visit it, or you can go to the link in my bio for 40% off their unlimited access Vantage plan. It's the best thing I've ever done to help deprogram my MAGA father. My name is Mercedes Chandler. Give me a follow or you won't see my face again. Thank you. Goodbye.
And yes, you guys, what do you guys think? What do you guys think of MAGA, how they are now crying? Oh, we're gonna lose our health care, and they don't even know. So, so they are like, I'm glad that I have the Affordable Care Act. And then that I don't have Obamacare because they're going to repeal Obamacare. And then they say, Obamacare is Affordable Care Act. Oh! Yes, so just keep doing that. So we just made it towards the end of this video. Please don't forget, drop a like, comment, and subscribe. It really helps my channel to grow and helps other people to find my content and my videos. Please help us to support liberal media. Subscribing to my channel. The MAGA nuts have all the subscribers and all the likes. So help us to support liberal media subscribing to my channel. Thank you. Bye-bye.